Morning sickness is a feeling of nausea and vomiting that typically occurs in early pregnancy, typically wears off at about 12, 13, 14 weeks of pregnancy, but in a small proportion of women can persist the whole way through.
Well, morning sickness is probably not very well named in that, yes, many women do get it in the morning when they get up, but a lot of women get it at all sorts of odd times during the day, and some women have it all day.
Nobody knows for sure what causes morning sickness, but almost certainly it's due to the hormones of pregnancy, the hormones that are made by the placenta, the afterbirth, and by the baby itself.
It usually occurs in the first third of pregnancy, so it's usually gone by about 13 or 14 weeks. Most women, it's not disabling, but you get the odd woman who finds it very difficult to go to work, and you get some women who even need to come into hospital for it because they get so dehydrated they just can't keep any even water down.
Paradoxically enough, it seems that the more morning sickness there is, the worse a woman feels in early pregnancy, the better the outcome for the pregnancy. So the lower the risk of miscarriage, statistically speaking, and the lower risk of some problems of later pregnancy as well.
So there's lots of positive things you can say about having morning sickness. And that's probably because if you restrict people's calorie intake a little bit during the first third of the pregnancy, that it means that they grow a slightly larger placenta, and that seems to be a good thing for the baby.
It's very hard to predict who's going to be affected by morning sickness. And in fact, if a woman has really bad morning sickness in one pregnancy, that does not imply that she's going to have bad morning sickness the next time. There's no predicting from one pregnancy to the next.
If you have two digestive biscuits while you're still horizontal, people often find that very helpful. And not to have any fluid until you're actually up and around and feeling a little bit stronger. The other things that people often use and are said to be helpful are ginger tea, and also acupuncture or acupressure bands can often be quite helpful. Now, if women are having a lot of trouble with morning sickness, then usually it's a good idea to see the midwife or the doctor and get advice about what other medications are useful and safe in early pregnancy. But it's a good idea to exhaust all the other things before you get to that point.